Dinesh Thakur joins me now from Gurugram in India. He's a public health activist and author of the book, The Truth Pill, The Myth of Drug Regulation in India. Really good to have you on the program with us. What,
Okay.
what do you know about these ingredients of concern, and why would they even be in these medicines?
Well, they should be. The cough syrups, typically for children, they use a solvent called propylene glycol. And every manufacturer is supposed to test these, raw materials before formulating, their cough syrup. In all these cases of mass poisoning in the past, what has happened is that the manufacturer doesn't test the raw materials properly, which basically is a reason why an industrial solvent like diethylene glycol makes it into manufacturing of medicine, which it ought not to be.
So, what's the regulatory process like in India then? How can these companies slip through these dangerous, even lethal ingredients?
Well, India has a very porous, drug regulatory process. It's a very large country. It has many, many states, and there is a central drug regulator. But most manufacturing is regulated by individual state drug regulators who don't necessarily have the wherewithal in order to ensure that proper good manufacturing practices are followed by these companies.
So, how large is the problem, you think? I'm just thinking in the United States, there's such strict approval required, and you often hear about products being pulled from store shelves even after they've been released and passed these
Right.
approval processes. But you don't really hear about that happening in India.
Well, India doesn't really have a drug recall law, unlike the United States. In the United States, the Code of Federal Regulation 211 essentially mandates that if there is a problem, if you find out that a marketed product happens to be substandard or fails stability testing, the law mandates to recall that product from the market. In India, there isn't such law, and therefore, even though the Indian state drug laboratories find Indian medicines to be either substandard or what is traditionally called in the law here not of standard quality, there's nothing in the law that would mandate, the drug regulator, just like the US FDA, to recall products in the market.
So, is this a potentially much wider problem than we even know about?
We just don't know. I mean, we don't know how far and wide this company's products have been procured. For example, in order to export, to a foreign buyer, the WHO mandates a framework called Certificate of Pharmaceutical Product. Now, did the Gambian authorities require that particular certificate? Is Gambia the only country in Africa that has procured medicines from this particular manufacturer? We just don't know answers to these questions. I think the WHO needs to come out clean and answer these questions.
So, if we don't know how widespread the problem is, should people be concerned about their medicine or other medicines that may have come from India? And how would people even know? Because I don't know that I've ever even looked at the medicine that I buy and take note of where it's come from.
Well, typically we don't, right? I think, when you go to the doctor and get a prescription, you expect the medicine to work. The challenge with medicine, that comes from India is there are two different standards of manufacturing here. A stricter standard for manufacturing and export to countries like the United States and Western Europe, where there is strict regulation in terms of the quality of medicine in their markets. And then there's a different standard for local consumption in India, and also to countries where the drug regulatory framework is not as stringent as it is in the Western markets. And so that's the reason why you see these kind of incidents happening. Uh, in a country like Gambia, a small country that doesn't have the state capacity to regulate and test its medicines, it relies on the World Health Organization to ensure that it's getting quality medicines wherever they're manufactured from. And that's the reason why it becomes important for the WHO to come out clean and explain how this process works, is if it is broken down, and what needs to happen to try and fix it.
All right, we'll leave it there. Dinesh Thakur joining us from Gurugram in India.
Yeah.
Thank you.